Currently, as far as clinical trials at the West Clinic are concerned, we have clinical trials for most of the common solid tumors. To a doctor, that means breast cancer, lung cancer, prostate cancer, colon cancer. These unfortunately remain incredibly common tumors. There are large numbers of patients with these problems, and we have clinical trials that address various stages of those cancers. Sometimes a clinical trial is only for patients who have never received chemotherapy. Sometimes it's only for patients that have gotten worse despite one or two chemotherapies. These are described by the doctors as inclusion and exclusion criteria. So someone, for example, might need to be female to be in an ovarian cancer trial. That's sort of an obvious inclusion criteria. Sometimes they're more complicated than that. We think that almost all patients are eligible for evaluation in clinical trials, but based upon the criteria for any one trial, not all patients will be eligible. We're currently recruiting for a variety of clinical trials across that spectrum I've described, but what would be important is to contact the office and speak with our research nurse about what trials may be suitable for you, the individual patient. I think that's the key thing. Whether a patient lives in Singapore or somewhere else in Southeast Asia, I think that they are eligible for our clinical trials. The key on our end of the clinical trial process is what we call informed consent. And informed consent is not a document that says it's okay to be in a clinical trial. Informed consent is a process by which we explain to you the reason for the trial, who is sponsoring the trial, what are the risks and benefits of the trial, and what are the alternatives to not being involved in the trial. And the key aspect here is language. So as long as I have an informed consent document and process that can be done in the patient's mother tongue, then patients from abroad are certainly eligible for clinical trials at the West Clinic, Singapore. Angie's an amazing patient. She presented to our center more than 10 months ago with advanced breast cancer that had spread literally all over her body. It had been misdiagnosed, or at least delayed in diagnosis as either kidney dysfunction or bone pain related to arthritis, when in fact she had breast cancer throughout her body. She was initially given a standard chemotherapy and had a wonderful response. However, later that treatment failed her and the cancer came back rapidly. During the time that she was on treatment, she was doing remarkably well, went back to work, and continued to lead an active lifestyle. When the cancer progressed, she was still able to lead an active lifestyle, but we've now switched her to a new chemotherapy program as part of a clinical trial. Initially, we treated Angie with a kind of chemotherapy that some patients call baby chemotherapy, and that's not chemotherapy for children. It's taking the standard chemotherapy regimen, and instead of giving a large dose every 3 weeks, we can often give a smaller dose weekly, 3 weeks in a row. So by splitting the dose into smaller, more frequent treatments and avoiding the larger single high-dose treatments, we can not only get the same benefits, but we can avoid some of the side effects that are commonly associated with chemotherapy that people know about just from reading the paper or watching a movie. This kind of baby dose chemotherapy not only provides the same results, but in some circumstances can provide improved results over the more traditional large dose every 3 or 4 weeks. I personally am a big fan of small dose frequent chemotherapy over the large dose approach, and in fact some of our patients take a tiny amount of chemotherapy every day with an approach that's called metronomic chemotherapy. You may recall from piano lessons that the metronome goes back and forth to keep your pace. Well, metronomic chemotherapy is taking a small dose of a chemo drug on a daily basis, and what this does is it can actually stop the blood vessels from growing that feed the tumors. So it's an anti-angiogenic strategy as well as a traditional chemotherapy approach.
This breast clinic was recommended by my breast doctor when I first discovered breast cancer. So she was the one. Actually, she gave me two doctors' name, and I don't know, Dr. Tucker's name appeared to me. So I said, well, I think since he's from US, I thought maybe give a try. Because I know US, they are quite advanced in this technology, especially cancer research, and especially with Dr. Tucker about 20 years, 30 years. So I thought it would be good to, of course it's better to get someone that is experienced, US. So that's why I ended here. When he first treated me, he says baby chemo. I was wondering what is this baby chemo all about. So it's something that is small scale. So they'll treat accordingly, progressively, and I'm really thankful that I don't have much side effect even after the chemo. I eat well, I sleep well, I don't have all those whatever the people are talking fearful things people are saying, but I was okay. In fact, I'm very happy and joyful here. Those some of my friends have come here and said the doctor is very good. Actually I said I come here every day, almost every week, and I feel very at home, no fear, because the people here not only Dr. Tucker, the teams are very kind, gentle, and they are really very helpful. That's why I said it lives to the name Excellent Healthcare. Yeah, I want to thank Dr. Tucker and even Nancy, who has been so kind and so gentle and so helpful, and most importantly, they are very comforting to me, and I really receive encouragement from them. And I think even when they talk to me about certain issue, I feel very at home. I don't feel fearful, no. So that's why when I come here, I was very joyful. That's what they say. Hey, you're always joyful. I say yes, because I feel at home here.